Hello, everyone. Good afternoon. Hope you're doing terrific today on this Wednesday, June 15th. Welcome to today's IECHI Quarterly Health Education Forum, Teen Mental Health in the Inland Empire, Assessing Challenges and Improving Outcomes. I'm Allison Elsner, and I'm the CEO of the San Bernardino County Medical Society. And I'm also the chair of the IECHI, or the Inland Empire Coverage and Health Initiative. I'm sorry, the new name, Community and Health Initiative, a coalition whose mission it is to ensure that all families and residents have access to affordable, quality, and culturally sensitive health care in the Inland Empire, including Riverside and San Bernardino counties. You can always find more on our website at iechi.org. And please be sure you like and follow our Facebook page under IECHI, because you'll find some very interesting project and event announcements on there. So as we get started today, I do want to welcome our IECHI board members and advisory council members, as well as our task force members. We have two task forces, rural healthcare and advisory. So thank you all for your work that you do to advance the IECHI. And I also want to give our usual shout out to Superwoman, our IECHI consultant, Victoria Stephan. Victoria, give a wave. She's the wizard behind and often, as I like to say, in front of the curtain, who really keeps the engines of the IECHI running and manages our grant funding and all of that. So thanks, Victoria, for all the great work you do, especially having just returned from 3 weeks in beautiful Italy. So just a couple of quick notes. If you'd be so kind as to keep yourself on mute when you're not speaking. And for questions, we will do a Q&A after all of the presenters have had a chance to speak. But we want to wait until closer to that time so that everyone does have a chance to make their presentations and provide their responses. We'll go ahead and take your questions by the raise hand feature through chat. So as you come up with questions, feel free to enter those on chat. Or if you're more comfortable, asking verbally, go ahead and do the raise hand feature when it comes time for the Q&A. And Soteria, would you wave at everybody? Soteria is my colleague at San Bernardino County Medical Society. She'll go ahead and field the questions and read them aloud at the end of the panel. So go ahead and enter those at your leisure. We'll have our keynote presentation followed by our panelists who will respond to guided questions. So I would like to begin by introducing our keynote presenter. Nicole Watson, EdDCP, AMFT, Mental Health Programs Director for Operation Safehouse. Nicole Watson is an Associate Marriage and Family Therapist and the Mental Health Programs Director for Operation Safehouse. She has been in this supervisory role for a little over 4 years, managing the following programs: Stress in Your Mood, Cognitive Behavioral Intervention for Trauma in Schools, Seeking Safety, and Peer-to-Peer program. All the programs that are managed by Dr. Watson are mental health focused and use evidence-based practices that are geared towards prevention and early intervention. The goal of the services is to destigmatize mental health and provide effective coping skills during early onset of mental health concerns. Prior to this position, Dr. Watson was a clinical therapist at Operation Safehouse for 7 years, providing no-cost mental health treatment to transitional age youth, TAY, ages 16 through 25, that were experiencing stress and or depression. She has experience working with cases from minor depressive mood disorders to more severe cases like schizophrenia with comorbid addiction. Nicole is an only child, yay, I am too, Nicole, and was raised in a single parent household. She values family since they were very supportive in her upbringing, and the reason she's the woman she is today. Yeah, awesome. When not at work, Dr. Watson enjoys learning new things related to holistic health, cooking new recipes, and doing guided meditations. With that, we are very happy to introduce Dr. Nicole Watson. Nicole, take it away.
Thank you so much. Good day to everyone. So happy to be here. And just taking a moment to just educate you on things that we've learned as an organization. And yeah, so let me get this started. Okay. Can you guys see that?
Yes.
Yes. All righty. So Again, my name is Nicole. Thank you guys. So let's go. How do we go to the next slide? Got it. Okay, so here's a term that I'm sure most of us have heard before in our adolescence, and that term is sticks and stones may break my bones, but words can never hurt me. And, you know, growing up, I don't think we really realized the impact of how words impacted us. And so there was a researcher, her name was Maria, her and some colleagues did a study. And what they did was they took subjects and they had them respond to auditory and imaginative negative words to see how did that affect their brain. And they realized that not only did the negative words and the negative imagery affect their brain patterns, but as they got older into adulthood, those same negative words were still haunting them. So one question that I have for everyone is, what is one thing you remember an adult saying to you as a teenager that you still think about today? If anybody wants to be brave and answer. So I'll go first. When I was probably about 15 years young, I had a family member say to me that pretty much because of my attitude, I guess at the time, you know, being a teenager, you know, just stated, I don't see you going very far in life because pretty much your attitude is negative, right? So now in hindsight, that family member is one of my favorites, and my accomplishments have just superseded beyond what they expected. Because again, being raised in a single parent household, having no siblings, my parent-daughter relationship was very open. So people looked at that and thought, oh no, you're probably not going to do that great, because I wasn't raised in a very disciplinary environment, but that was not the case. So does anybody want to share anything that they can think of that someone may have said that it can still penetrate you today?
I can. A teacher once told me I was stupid. And to this day, when I see teachers acting in a negative way, being that I worked in the school system for 22 years, it sure comes right down home. And I know how wrong it is.
Absolutely. Thank you for sharing, Jessie.
I could share as well. I'm petite, so I've been told that I'm too small to do anything or to do many things. So, yeah.
I had one, this doesn't sound necessarily like a negative, but this kid in high school told me, he said, you know, you're way too close to your mom and your parents. You're never going to amount to anything because you're going to be afraid to do anything in life. Well, of course, that's the exact opposite. You know, I was like, that's not true. It makes me more secure, you know, and more able to tackle things in my life. But I've never forgotten it. It made me defensive for some reason, and it kind of hurt my feelings.
Wow. Thank you. Thank you for sharing. Anyone else? No? Okay. So just a little bit of information about, how do we go back? The development of a teen's brain. So our brains are developed from the back to the front. And when we think of a teenager, their brain hasn't completely been developed. And so if they're lacking things in their frontal lobe, this is going to affect their maturity, and it can actually trigger maladaptive behavior. So sometimes when we're thinking about teens and their behaviors, it's not adding up. So if this prefrontal cortex is not fully developed, it will affect the way that they think about complex things, about how they plan. It will affect their impulse control, their emotional reactions, and it also affects their ability to focus. Okay. So here are some developmental things that teenagers could be experienced between the ages of 15 to 17. So they're going to be exploring intimate relationships, trying to figure out not only who they are, but what attracts them about other humans, right? They could exhibit more conflicts with parents and or guardians. They're going to be searching for more autonomy, trying to figure themselves out to see, okay, who am I outside of the home? They may start spending more time with their friends and want to be around their family less. They may begin having early onset symptoms of mental illness based on what they've been exposed to. They have a better understanding about negative and positive behaviors. So they're starting to learn the difference between what is right, what is wrong, what is acceptable, what is a societal norm. And then they may begin to show concern about their future. Because one of the things, of course, being a teenager is once you become an 18, you're an adult, what's next? Okay. So the World Health Organization put out some statistics. Now, these are global statistics, but it still applies to us, right? So 1 in 7 10 to 19-year-olds will experience a mental health disorder. Depression, anxiety, and behavioral disorders are among one of the leading causes of illnesses and disabilities among adolescents. Suicide is the 4th leading cause of death among teenagers between the ages of 15 and 19. And the consequence of these youth not getting the services that they need in a timely manner will affect them in adulthood, not only impairing their physical health, but also their mental health. Okay. Alrighty. So here are some things. Now, these things that we have discovered are based on self-report. So as you know, our organization, we are out in the field. We represent 3 different regions. So we have our Western region, our Mid-County region, and our Desert region. And these are some of the things that the youth are stating that they're facing right now currently. So one thing is not feeling safe, which is one of the most major things. And if a person is not feeling safe and they're maneuvering from a fear-based frame of mind, all logic goes out the window. So anytime there's fear, that emotion automatically takes over the brain and all other emotion and logic is absent. Another thing the youth are saying is that they're not being heard. So a lot of times when youth are expressing that they're having these feelings, sometimes adults will tell them, you know, it's just a phase, or you'll get over it, or, you know, snap out of it. Some even say, well, you know, if they have a religious background, we'll just pray about it and it'll go away. And as we know, in the mental health realm, that is not the case. Another thing is lack of being validated. Again, when these teens are coming and saying these things that are going on with them, a lot of times there's no validation. It's kind of just being ignored. One thing that I thought was really interesting is not learning essentials to become a mature adult. So the way that the world is now, technology has taken over so much that these teens are feeling like the adults in their life are not taking the time to say, you know what, here are some things that I can teach you. So when you do become an adult, you pretty much have these tools in your toolkit. So that's lacking. Another thing is family dynamics are changing drastically. So we've noticed an increase in CPS reporting in our mental health department. And it's just unfortunate, but families are getting broken up. People are having to go live with extended relatives, live with friends. Again, very dramatic and not fair, but these things are what are bothering these teens. Another one is substance abuse in the home. Since the whole pandemic started, when people were having to stay at home, there was an increase in substance use and abuse in homes, and this is definitely something that they are being affected by. Again, domestic violence. Domestic violence has been there, but again, when everything was shut down and everybody had to be in the same space for 24 hours unless they had to leave for, you know, essential things, domestic violence rates also increased in the homes. And so really having the kids not being able to go and engage in school functioning or functions wasn't really that great if there was violence and substance abuse in the home. Another thing that we've noticed is homelessness. And I know when we think of homelessness, we're thinking, oh, let's, if we drive down the street, we'll just see someone on a street corner, but that's not always what homelessness looks like. So sometimes a homeless youth can be couch surfing. So again, going and staying with a friend. This is actually the first year that I've ever worked where we've had a clinician who had a person that they work with actually having to sleep in their car. For our organization, we had that, but when we provide our mental health programs, usually we don't run into that. So homelessness has definitely increased. Social media pressure. That one is like so major because now everything is about instant gratification. So when these youth are doing their best and putting on their best and not getting recognized the way that they assume they would, it is definitely affecting their mental health to the point where some have actually died by suicide because of the lack of not being recognized because of social media. Then we have relationship difficulties. Again, another thing that I'm noticing, relationships are becoming more toxic. Intimate relationships are becoming more toxic within these teens. And again, they're not really learning the safety of being in a relationship and not being taught what does genuine love look like. Another thing is undeveloped coping skills. So going back to, again, the adults in their lives are not teaching them the proper coping skills that they need to deal with their mental health. And then the pressure to succeed. Even though everybody is going through everything, there's still this pressure that they have to show up, they have to succeed, they have to be perfect. And a lot of them, this pressure is giving them the ability to just say, you know what, I just give up. And then we have teen births. Another thing. So what I recognize is the teens are not really being honest and upfront about their behaviors within each other interacting. And so the teen birth rate definitely increasing. And another thing that's affecting them are the school shootings. Based on looking at our Inland Empire, we haven't had anything this year, but in other states, things have taken place. However, we have had incidences already where there were threats in several of the school districts that we work in. There was one school where a teen actually did bring a weapon to the school site. Thankfully, the police were able to apprehend the student before they did anything. But this is something that's definitely affecting the mental health of teens right now, is how can they be focused on what it is they need to be learning when there's that fear factor of, well, what if somebody comes into the school and does something horrific, right? So they can't even stay focused enough to learn the things that they need to be learning. Another thing that we've discussed on several occasions, our students are learning more about what's going on in the world. And based on this recent thing that's taken place, we've noticed that a lot of the teens are now being discouraged to enlist in the military because their thought is, why would I want to enlist in something that is basically going to end in tragedy? So I thought that was pretty interesting. Another thing is being open about their sexual orientation and gender identity. Even though we have gotten so far ahead with all the support, students and teens are still battling with this. And another one that they said is dropping out of school and not graduating. There seems to be a lack of motivation across the board, where the students now, because social media is so prevalent and now they're learning, like, I don't need to graduate from high school, I can just go be a social influencer, right? So we're noticing that teens are just not motivated like they used to be to participate in school things. Okay, next. So what are some things that we can do to help improve these outcomes with the teens in the Inland Empire? So one is recognizing early onset mental health concerns, which can be a bit difficult because a student who's depressed, two students that are depressed can be exhibiting two different symptoms. but just being educated about what are early onset symptoms of these things. Allowing the teens to have a safe place to get help is very, very important. Getting more parent involvement, definitely, or the guardians involved in the teen's life is very, very important and can actually improve them with mental health. Learning the signs of mental distress. So I know recently there was a person who disclosed that they knew someone who died by suicide, and they were just absolutely surprised because they said they had no idea that, you know, this was going on with this person. And, you know, there was a little bit of guilt because this person works in mental health and then this person does this. And so it's kind of like, so you have to just really have to start learning these teens' behaviors. And when it starts to change, they need to be questioned. Another thing would be have resources available at spaces teens spend a lot of their time at. So if it's like public places like libraries, one interesting idea that one of my coworkers had came up with was adding flyers in like the boys and girls bathrooms at schools or in the mall. Because, you know, with a QR code where it's very anonymous, nobody will know, but it's there, and the restroom is a place that people frequent. So it will just give them an opportunity that if they need to reach out, it's readily available. Giving teens access to services while in school, again, very important, you know, to have outside contractors come on school campuses, because majority of the time, you know, teens are in school, could be very helpful. Offering the teens mentoring programs. So again, another thing that we see is these teens saying they're not getting the guidance that they need. So being able to offer them some kind of mentoring will be very beneficial. And of course, offering them prevention and early intervention programs, which is the thing that we do and we love the most, is helping these teens get these services before it gets to the threshold that it becomes a long life concern into adulthood. And another thing that's very useful is if you are working with teens, is to use the SWOT analysis. And this is going to help you get more information about them, learning what are their strengths, what are their weaknesses, what opportunities do they feel they have, and then what are some things that they feel are threats to them. And in doing this, you can kind of just gauge, again, where they're at, and then figure out ways or give them resources on things that they can do to work through these things. So a lot of the times with teens, you may ask them, so what are you good at? Or, you know, what are you not so good at? And a lot of times they'll say, oh, I don't know. But just being able to sit there and just really dive deep and having them answer those questions can be very helpful. Yes. And here are just some resources that we use as an organization. I know there's so many. If I would have put all of them, my goodness, that would have just been too many to put. But right here, the Desert Flow Stepping Stones in the Arena. The Desert Flow is in the desert. The Stepping Stones is located in Riverside, and the Arena is located in the city of Paris. These are 3 drop-in centers that if teens are feeling like they need support, they can definitely go to these centers to get the help that they need. And in closing, I just want to say thank you. And this quote that I thought was very profound is, "There is hope, even when your brain tells you there isn't," by John Green. Well, thank all of you. Thank you.
That was really outstanding, Dr. Watson. That's so fascinating to really reinforce those factors involved. So good to raise awareness. Thank you for that presentation. Really appreciate it. Lots to think about there, huh?
Yes.
And we appreciate your work on this. It's really good to have experts involved in this. Thank you. Means a lot. So, yeah. So, alrighty. Now I'm really pleased to be able to introduce our 2 expert panelists who are going to respond to some guided questions that I'll be presenting to them. And we actually had a third panelist, David Bond, with Blue Shield of California. He was director of behavioral health there. And unfortunately, David had a family emergency today, so he will not be on the panel, but that's okay because our panelists that we do have are amazing. So I'm going to go ahead and introduce them, and then we'll start our questions. First, I'd like to introduce Ms. Jessie Huerta, AMFT. And Jessie is a clinical therapist with Operation Safehouse. She's involved in providing emergency shelter, intervention, and outreach for youth in crisis. Intervention is offered through CBITS, which is Cognitive Behavior Interventions for Trauma in Schools. Ms. Huerta has overcome many challenges, including being a first-generation college student and graduating with a Master of Arts in Counseling and Psychology. Way to go, Jessie. She's a seasoned therapist having experience with adolescents, adults, and special needs children. Her specialty is family reunification, acculturation, and self-empowerment. So welcome. We are so happy to have you here today, Ms. Huerta. And then I'm also going to introduce to you Dr. Timothy Hougen. Timothy E. Hougen, Ph.D., is the Deputy Director for Outpatient Clinics and Youth Services, OCAYS, OCAYS, within the San Bernardino County Department of Behavioral Health. As such, he oversees services to children, youth, and adults provided at local community clinics, regional transitional aged youth, TAY, centers, and countywide children's programming. Dr. Hougen has historically served children, adolescents, families, and adults through a variety of mental health programs. The focus of these programs has been children and youth with serious emotional difficulties and adults with serious and persistent mental illnesses. Dr. Hougen completed his bachelor's degree at the University of California at Santa Cruz, his master's and doctorate at Rosemead School of Psychology, Biola University, and his internship at the University of Rochester School of Medicine and Dentistry, and his fellowship at Catholic Charities in San Diego. So welcome, Dr. Hougen. We are really, really psyched to have you here today too. All right. I'm going to ask some questions. And since we have two panelists, I think we have enough time to have each of you address each question. And Dr. Watson, we'd like you to jump in here too. You can be our third respondent for each of these because we certainly want to hear your responses and your input as well. So, all right, our first question. What are you finding to be the most concerning mental health challenges for teens in the IE? Why don't we start with Jessie?
Hi, everyone. Thank you for having me. Thank you, Nicole, for guiding me. I think in working with the youth that I have for the many years that I have, but in recent years, it has really, really climbed, and that is suicide and suicidal ideations. They're not always taken seriously. Parents sometimes think, oh, shut up, you're just trying to get attention. But students and young and even not so young, I would just say young adults that have experienced really, especially in the military experience, I think the suicide is very high. I volunteered for some time on there. Also in young people that they have incidents happen to them during their youth that are sometimes out of their control, but they find themselves in legal issues. They also miss out during their youth years in developing, and they also become, big. And then, of course, the availability of guns. Anytime any of the not just young, but they make a joke, that I think I'll just kill myself, and then I have to go in there and find out if they are really serious. But my number one question is always, what is the availability to any weapons in your home? because that is very, very predominantly in my, especially in my culture and acculturation, but not only in my culture. Acculturation is one of my, and some of the figures that I have here is that in the last, I would say, I think these numbers are probably right about probably 2 years old. They're not, but I would say a year and a half to 2 years. And suicide has risen and is now at 60% of those that threaten, say they're going to have an ideation. They may not always succeed, but they are part of those numbers, in 60.3%. And homicide, that of course we all know, that is when someone picks up a gun or any other kind of a weapon and threatens another person, that they don't always have to succeed. They just did the attack. 36.3% in our Inland Empire. And sometimes unintentional, and unintentional at one time used to be like 10, 15 years ago, it used to be quite high, and now it's only 1.2%. Unintentional meaning sometimes, somebody will shove somebody accidentally, but no intent of hurting anybody, no bullying, no history of any ill intent towards that person or anyone in general. Then there is the undetermined, and that's only way down to 9%. So those are my answers to that question.
Wonderful, wonderful. Thank you very much, Jessie. Dr. Hougen, would you like to respond to that?
Sure, happy to. Thanks for having me. I'm going to respond in a little bit of a different way initially and include a book recommendation. And so, we're talking about the teenage years, but really right before that, we have childhood. And what comes next is adulthood. So a couple professors from UCLA recently came out with a book called Wildhood. And it is their proposed name for that part that we're talking about. Childhood, wildhood, adulthood, and that transition. And it's a very clever way of looking at it. And the book, by the way, I find really fascinating because it is not about humans. It's all about everything else in the world that has a childhood, an adulthood, and a wildhood. And so you learn about sperm whales and wolves and various animals that are basically making this transition. And the authors really emphasize the point that when you get to adulthood, you're able to keep yourself safe, right? You're able to get along with people. You end up with some intimate partner. You leave the nest, whatever the nest was, and you take care of yourself, right? And that in between childhood, when you could do none of those things, you've got this period of time that is actually really dangerous, right? It's dangerous because you don't know how to do these things and you have to learn them. And so one of the things that I found fascinating about that was that notion of, they basically, through adolescence, we had to, right? We all went through it, have to learn how to stay safe. We have to, and this is the critical one, I think, for so many, learn how to navigate that social hierarchy, right? And the book has so many great examples of packs in which the animals have to navigate that social hierarchy, right? We have to learn how to communicate in some sort of sexual manner, right? And then learn how to leave the nest and actually do something. And so I say all of that when we say, what are the mental health concerns for adolescents? Let's remember all of them have something that is going on, and it doesn't matter who they are. The most resilient teenager is going through a massive transition that is really, really difficult, right? And so it is that same thing, and I don't believe the pandemic has really helped anybody learn how to navigate social hierarchies, right? So I don't believe they've brought people together. I don't know, maybe they've taught us a little bit more about staying safe, but I don't really believe that, because you have to be able to navigate the world, and many people have basically isolated because of this. So I think across the board, everyone going through this age of wildhood, if you will, if we can agree on the book's term, it's suffering during this time and having a harder time. And then when I reached out to all of our providers, and I just have a network of folks who provide services at schools, and reached out to them, the exact same things that Jessie is mentioning are coming up, right? It's depression, it's anxiety, it's anxiousness about the future, it's worried about school shootings, it's fear of missing out because they're not allowed to do something, it's not being taken seriously, it's not being able to be accepted for your sexual identity. It's all of those things are coming into play. But what is different is it feels like it's more. It's more people, it's a higher percentage. And I think this is the part that's difficult to sort of quantify. It's more severe. The kids are coming in for services to our programs that are designed to help them deal with depression. And instead they're coming in with depression. And it is not depression, it's depression, and it needs more. And I know that inflection doesn't quite capture it, but it is distinctly more severe. And I know this isn't part of the question, but I feel like it needs to be stated.
Of course.
We're dealing with this all at the same time as we're having massive staffing problems.
Mm-hmm.
And I don't mean problematic staffing. I just mean we're not finding people, right? I've never seen a situation in which, and this is happening to us and our providers throughout our system, we have people ghosting us for professional interviews.
My gosh.
We have people who were given start dates who don't show up. So there's something culturally going on for us as well, that the adults in our society, sorry, this is my opinion, aren't quite stepping up to the plate for the youth, right? If the adults in our society can't show up to a job interview that they agreed to, then what are they going to show up to for our youth? What does that look like? And so I apologize, that's a different tangent. But I think all the same things that Jessie said, as you said, but I like looking at it within the context of every teenager is going through something, right? Even if they're doing it perfectly, right? They've got all the stuff in play, they've got family, they've got people outside of the family that care about them, they're involved in stuff that they feel passionate about, all of that. Still a process, still difficult.
Thank you.
Is that okay, Allison? Okay.
Well, more than okay. That was fascinating. I like how you brought in some other elements of the whole sequence of events there, especially childhood. That was interesting. Yeah, good perspective.
One last thing on that book, sorry, that I found so fascinating is they point out that this is the first time that humans have to navigate these 4 elements of this transition in both the real world and the virtual. And we really don't know what that means, right? It's a very, very different process to do that.
Yeah, okay, wonderful, thank you.
I agree with him on that analogy, because many times during my career or during my practice, I have, come across where I'm saying, oh my God, especially when it comes to child abuse. Animals don't even do that.
I know.
And, it's a very good analogy. Thank you.
I've thought of that so many times that it troubles me a lot that humans do so many things that animals would never do. They have no guile like that, no ill intent. And it's amazing to me the things humans are capable of, but I know that's another subject. Yeah, that's another time, longer discussion. Dr. Watson, would you like to answer that? If you add anything to that about the most concerning mental health challenges for teens?
Well, definitely, I have to concur that it is the suicidal ideations. And just really quickly, we had one of our clinicians have to deal with a student who actually had access to a weapon and drove off to die by suicide, and the gun was empty.
Oh,
So when I tell you it's getting more intense and these kind of cases are happening, it's kind of like it's so imperative for people to know if they choose to have weapons in the home to just keep them safe.
wow.
Yeah, there was a discussion that I was having, and it was around the gun control and gun laws, and I don't have an opinion on it, but the person was saying if there was one person who had a weapon to come in to rob a bank, but 80 people in there who also had weapons and said, we're not going to lay down, you lay down, who in that situation is going to win the battle? And I'm like, I never thought about it that way. Never. So when they say gun control, it's about, well, who's going to take control of the floor right now? The one or the 80 army? I'm like, oh, good question.
It's a really interesting perspective on that. I love that. Wow. Okay, thank you. All right. Next question. What services is your agency providing to support teens in the IE? Well, obviously you've addressed a lot of this with both of what you've talked about, but Jessie and then Dr. Watson, do you guys want to start with this? And again, if you've covered a lot of this about what you provide at Operation Safehouse, but if you want to hone in on any of that, we'd love to hear about it.
Nicole covered all our different programs.
Yeah.
The program that I cover is school-based, and I don't have many years experience with it. Actually, this is my first year working with it, but it does offer services. It opens the door in order for us to be able to offer a more extensive service if it's needed. And we discover topics like substance abuse or the suicidal ideations. Even though that is not what we are teaching, we're teaching them to, or working with them to learn to provide them with skills so that they can make better decisions later on in life and coping mechanisms.
Yeah. Okay. Dr. Watson, do you have anything to add about your programs that you want to emphasize?
Oh, yeah, so pretty much like I mentioned before, we offer services in 3 regions, Desert, Western, and Mid. So currently we work with approximately 12 to maybe 13 school districts. All of our programs and services that we provide are no cost. The age range is between 16 and 25 for the majority of our services. So we have one that focuses on stress and depression, one that focuses on PTSD and substance use. And then we have our peer programs that focus on multiple things. So they do a coping and support training, they do mentoring, they advocate for directing change, they tell their personal stories, they have an LGBTQ support group. So again, those are some of the things that we provide, and all of our services again are mental health based, and it's one of our objectives is to destigmatize mental health and make it something normal that people can start talking about, so that way more people will actually start getting help.
Wonderful. Thank you. Dr. Hougen, how about you as far as going into a little more depth on any of the programs you provide? Do you want to talk about that a little?
Sure, happy to. Remember our role as a mental health program or mental health plan for the county of San Bernardino is much broader, right? And so we also have school-based programs. We have programs that provide more intensive services in the homes. We have programs that provide intensive one-to-one coaching for youth, things like that. And so they're provided by a combination of DBH operated programs. We have, for example, a TAY center serving 16 to 25-year-olds that is operated solely by DBH staff. And we have 3 other TAY centers that are contracted out with established and respected community-based organizations. So focusing a little bit on the schools, maybe, I think one of the dilemmas that we have, that most programs have, to be quite honest with you, is the funding seems to come from one source or another. And so the majority of our programs match the fact that we are the Medi-Cal provider, right? So we serve Medi-Cal beneficiaries who rise to the level of no longer being appropriately served by either IEHP network of care or Molina network of care. That's not a criticism of their network of care, that's just how California structured it. And so that turns into an issue for us because we're in the schools, and so we have we have referral systems where the schools can make referrals, but what the schools want to do is serve their children. They don't want to serve their Medi-Cal children, right? So we have some programs that we've tried to figure out some additional funding, but there's never enough of that. So we have a very robust Medi-Cal program, a less robust non-Medi-Cal program. And so someone had asked in the chat how we do that with the referrals, and the truth is any which way we can. So if we link individual providers with individual school sites, and so at least in San Bernardino, so we would have a community-based organization who would work with San Bernardino City Unified School District, and they would have a network where they could make easy referrals between the two. But I think we all need to be honest and say it isn't working as well as we wish, right? Which is one of the reasons why in the state of California, there's this student behavioral health incentive program that is currently being developed. And it's really, truthfully, a pilot program. And it's a fairly well-funded pilot program at like $398 million for the state. But IEHP and Molina are doing, for both counties, are doing an excellent job of steering that for us. But the whole focus of SB-HIP is to really coordinate people getting care, because we're recognizing that that's our problem. And the number of times a teacher, well-intentioned, says, I think little Johnny needs help, I'll make this referral. And the other staff member at the school district says, let me make sure this gets out to the right place. And the CBO or we say, great, let's follow up on that. And it doesn't result in actually seeing the kid, right? Because at some point, it's like, okay, how many phone calls before we say, all right, and remember, these are all voluntary. So it's just very confusing. And so I'm looking forward to SB-HIP actually being implemented in the school districts that have been chosen as the pilot, to see if we can figure out a better way to make sure that when the teacher says, hey, I think little Johnny needs some help, little Johnny gets help, right? Because it's a lot to navigate before you actually start helping somebody. And so that's what I would say. I say all of that with, we are committed to making that happen. And so with those referrals, if anyone ever has the experience of something falling through the cracks, I'm very happy to look into it and try to facilitate whatever needs to happen, because we do want the kids getting those services. But we have contracts and internal workers who provide services on school campuses, entry-level programs as well as intensive programs.
Wow. Okay. Thank you. Well, I guess kind of going to the next level on that thought process. So you kind of talked about it, Dr. Hougen, but what services are needed or lacking, and how might they be addressed in it, which incorporates more funding? We understand that. We all know that's always the ongoing challenge. But what do you feel most could be done or provided to fill in some of these missing links or gaps? And let's start with Dr. Hougen.
So I want to start with one of the things that you just said, which was always requires more funding. We're in a very weird place right now where our providers are unable to use the funding that we have allocated to them because they cannot staff at the level that they need. And so if I were to say to them, I'll double your contract, they can't get the staff in for what we have.
Oh my
And
God.
so right now, when we're talking about what's needed, there's a need for more intensive services to be available. In my county, I can't speak for Riverside, I think that may eventually mean more funding, but it doesn't now. Right now, it means we need to be able to figure out how to get staff into the chairs and into the homes of these kids that currently the position is vacant for.
Oh my
Right?
goodness.
I mean, our providers, we're looking at 25 to 35, 40% vacancy rates for some of the programs.
Oh my goodness.
And some of it is, quite honestly, the nature of the work we do doesn't lend itself for some of the sort of current standard perks of being in our field, right? So a lot of people are providing services via telehealth.
Yeah.
And that's great. And telehealth really works phenomenally well when it's being used appropriately. But it's not a very effective way to do one-to-one coaching with a kid who is distracted or angry, or, right? Yeah, Dr. Watson's agreeing, right? So so for many of the folks who are potentially leaving us, as well as for the lack of the people coming in, it's because they want something that doesn't require them to roll up their sleeves as much, doesn't require them to go into the home as much, right? And it's hard to get that population. I mean, that staffing population. So I think it is the intensive services. And then the other thing that I would go back to is I really think it's you know, every parent, every teacher knows that the problems are in the transitions, right? And so you've got your kids at the pool, everything is okay as long as you're not trying to leave the pool. When you leave the pool, that's where you're going to have problems. When you're trying, as a teacher, if you're trying to transition your class from this matter, this subject to that subject, it's that transition that we have difficulties with. And that's where I think, again, I'm very excited about the SB HIP efforts, because I feel like we need to figure out how do we help with that transition so that there's fewer and fewer children and families and youth that fall through that crack, right? When we're making that referral.
Yeah.
I don't know if that covered what you wanted, Allison.
Yeah. Wow. That's amazing. Yeah. Fantastic. Dr. Watson, do you want to jump in and talk about, if you had your wish list, what services or funding would you wish for?
Well, definitely, I really appreciate the services that we currently provide, but if we could get more funding and provide more services, hire more people on our teams, because the need is definitely there. But again, when you only have, 2 clinicians that are servicing one area, they can't get them all, and honestly, it would be nice to see more spaces for displaced families to go if they are in a crisis situation and need housing. I don't believe we have enough of that in at least in Riverside County.
That's interesting. Okay. Jessie, do you have anything you want to add there? Like, what would you like to see more of?
I would like to see more of the parent contact, being able to provide parents with essential information on how to handle these situations. We watched a movie for our supervision and the other day, and it had a scene where mother wanted to know what have you been up to, and what have you been up to, and the teen wouldn't open up, and when she did open up, she didn't know what to do with the information. It was too much for her. It's like, I want to know, but I really don't want to know. Do you really want to tell me all that? So you've done this and I think that parents are not alone in that. They don't they want to know, but they don't know what to do with the information once they get it. So I think having some funding to being able to let parents know what their kids are into and what's out there,
Right.
especially when it comes to the internet. The internet is a very dangerous place. Of course, we all know, we hear it in the news all the time. There's some things we don't hear in the news all the time. And sometimes those are even worse, because things happen to kids through the internet and they don't open up to anybody. They don't have anyone to open up to. And when they do open up, the parents don't know what to do, or, a friend or just someone, just in general.
Yeah.
And then, of course, the housing, I think it's also very important. And it's Dr. Timothy made the analogy about the pool, about not leaving the pool. And you're right, if you're in the pool, parents, are so busy, they leave the pool, and that's when it opens up for different, and the pool being used as the actual pool or the internet. Kids are at home all day long and they just do whatever they want to do on that internet. And before you know it, you may have somebody knocking on your door and say, something is going on. I mean, yeah, the sheriff department sometimes is very good at catching things.
Huh.
And some parents don't want to hear that.
Yeah, right. Surprise. Yeah.
Yeah, surprise. So
I
think all that
suppose.
information it's very crucial to give to parents, that the possibility is there that these things could be happening. And I think in a lot of the numbers have been going up when it comes to situations of that nature.
Wow. Well, I suppose too, if you have parents who, like you say, once they find out what really is going on, maybe they really don't want to know. If they've never learned the proper coping skills and things like that in their life too, that's going to be a problem on the receiving end for them, because they're really not able to impart that guidance to their
Right.
kids.
That's very true. And then, like, now we're dealing with something that I, of course, growing up, putting myself in a parental, I no internet, and definitely my parents had no internet. I didn't get my first phone till, I don't know, maybe 20 years ago. I didn't have a phone. I didn't want anybody to track me down. When I leave the house, leave me alone. Now, please track me down,
Wow.
Find out where I'm at in case But yeah.
Well, thank you for all of that fantastic input. Okay, and we have one more question here. How you kind of talked about some of this. How can other organizations and entities support teen mental health? Like do you have specific agencies and even funding sources that you wish you could tap into more? And how, while we're on that topic, how does your funding work, and where would, grants, donations, that sort of thing, and where would you like to see more of that? And why don't we start with Dr. Watson on that?
Absolutely. So we currently are funded by Riverside University Behavioral Health. All of our programs are funded through the Mental Health Services Act. So 1% of every person who makes $1 million pays a tax, and it goes to that funding. Okay. So yeah, an amazing thing that the state of California did. So, if they can just get more money from the state and put it in the county, and then they can have more contractors come in and provide services.
That's so good to know. I didn't realize that. I'm really glad to hear that. Provides some stability, at least, too, in the funding, right? Yeah. Okay. Jessie, do you have any input on that, about other partners that you'd like to see?
When I was working, doing the research for today, I took it upon myself to call places, just like, I need help. Can you help me? Yeah. And most of the places that I called either wanted insurance or wanted money up front, So the average person or the average teenager that has no knowledge of where they can go for some help is really, after I did it for about 2.5 hours, I just made calls at random. Of course, some of them, they're answering services and so forth. So my need, I think falls, I should say the responsibility falls on all of us that know and have the knowledge of these programs and where they are, to give this knowledge to the kids and to the parents. Because, and mind you, I only know a little bit compared to how much is out there. But I think these forums, I think, are a great source, because that's where I get a lot of my information from other people that we meet with, and I'm taking notes, so to know all the services, there are many services out there, but sometimes they go unheard of. They don't get, the population that they need. And sometimes, unfortunately, when that happens, and I know that for a fact, is that then their funding falls through, because they can't provide enough proof that they have the need, and the need is definitely out.
Wow.
It's just being able to spread it out.
Yeah.
So it's kind of a sideways research to that question.
Wow, thank you for doing that research. That was awesome of you. Dr. Hougen, what are your thoughts on that, on other potential partnerships, things?
I think one of the things that the MHSA 1% tax on millionaires is amazing, right? I can't say enough about that, and yet at the same time, it gets stretched pretty quickly.
Oh, sure.
And people oftentimes don't understand the need for a local county to keep some of that money in reserves in order to make sure everything keeps going. And so one of the sort of common practices of counties is to keep enough MHSA money in reserve, so that if we stop getting money from the state, which has happened, where they stop sending us money because they're tight, whatever that may be, then we have enough to not stop sending it to Dr. Watson, right? Because that's really where it becomes problematic. If the state says to us, sorry, we're not giving you anything for this quarter, and we say to Dr. Watson, sorry, we're not, now that's catastrophic, right? And so most counties keep about 5 or 6 months of that funding in reserve, and that makes sense. But it also sort of creates this weird dialogue, because that's a lot of money, right? I mean, it's tens of millions of dollars that's sitting there. And so then you end up with a lot of other agencies that don't have any necessary right to that money, thinking, you know what, I could use that. If you're not using that, I'll use that. I'd like to take that. And so you'll notice things at the state level where there are these conversations that go around. But you were asking about opportunities.
That's okay.
I really think that one of the biggest opportunities that we have has to do with Medi-Cal, because when you look at Medi-Cal, what has to be understood is that every penny that is paid out for a Medi-Cal service is actually infused with different funding sources. And so there's money from the federal government, and there's money from non-federal sources. And there isn't any rule about where that non-federal funding portion has to come from, other than it can't come from the federal government, right? And so we receive what's referred to as realignment money. And so for many of our programs, when we pay out one penny, it's infused with federal dollars and realignment dollars, and that's coming out of our local bank, plus the federal government is giving some money. But then we have some specialty programs where we've partnered with school districts, and we've been able to pull down that federal portion, and then the rest of it is made up of a combination of our money and their money. And so everybody is able to sort of get a little bit more out of it, if you will, and we can make that dollar go further. And so I really think that the funding opportunities are going to be these different agencies that have potential funds for Medi-Cal to get together so that they can make that dollar go further.
Yes.
And oftentimes that's a school, but it doesn't have to be a school, right? So there's other opportunities out there as well. We have a program like this with First Five, where First Five and us, we braid our funding together. And so there's just a lot of opportunities for things like that.
Oh, I see. Okay.
That's what I'm looking for. Yeah.
Okay. That's interesting about First Five. That's great. So these collaborations do exist.
Great organization.
Yeah, they are. A lot of, I think overlaps and interrelated areas for y'all. I realize with that. And I had asked Dr. Watson in the chat if you guys use ACE questionnaires, and I realize that's a kind of a part of this, but but mental health for teens is just one aspect of all this. I realize, and that's a huge aspect of it. So ACE kind of covers a lot of different things. But anyway, I'm kind of getting off on a tangent here. I could just ask you all my own questions all day, but I don't want to hog this forum. So let's go into our chat questions first, if that's all right with you all on the panel. And Soteria, do you want to start kind of going through some of the questions? All righty.
Sure. Okay, so you asked a few questions, Allison. And this is, it's to Jessie. When you provide help in schools, do school faculty, et cetera, provide referrals to you? Or do you go in and just make service available, or?
The school provides me with, can you hear me? Because,
yes.
Okay, because my screen did something funny and so I'm talking to a blind screen here.
We see you. You look wonderful.
Okay. The school, the counselors give me a list of referrals, and then I bring them in, and then we screen them. We do the screening. And then also, I don't think that I mentioned it, at the end of the 10-week program, because that's how long the program is, we take an evaluation. We evaluate them in the beginning, and we use a form to evaluate them that I believe is provided by the state. I'm not quite sure. Like I say, this has only been my first year doing it. And then at the end, we also do the same evaluation over again and see what we can actually see where there's been some growth on there.
Yeah.
So it's, yeah.
Wonderful. And I know Dr. Watson, you did also address this in the chat too. Thanks. You were great about keeping up with all of these. And you did indicate that some schools prefer sending referrals and others prefer mass screenings. Yeah, so then you answered the rest of this. So I'll let Soteria continue.
Okay. Do you want me to ask the next one?
Yeah. And again, okay. Dr. Watson addressed some of that, but we'll see what you all feel about
this. Okay, perfect. And this is, to Dr. Watson and Jessie, how do you measure success or improvement through some of your programs, aside from seeing certain young people make wonderful changes in their lives on a case-by-case basis?
Go ahead.
So the way that we're measuring is by using different assessments. So again, like Jessie had mentioned, we do a pre, a mid, and a post. And then also we have our clinicians doing observations, and then of course self-report.
And you do like scoring on that, on certain metrics of improvement, things?
Oh yes, everything, because it's an evidence-based program. All these things have been researched. And all the surveys and assessments that we use are in place because they are shown to be effective and can actually help you have a clinical judgment.
Yeah, clinically, clinical questions.
Oh, I see.
So even though it's not a clinical program, we get a clinical base on them. And that's why sometimes they will ask us, or inform us of clinical issues that are going on in their life.
I see. And do you, if something emerges through this process that seems concerning, then sometimes do you place referrals to other either agencies or providers through the public health department, or how is that what you would do in that case? Or
Working in the schools, and with my experience that I've had in the past, that information is, especially if it's suicidal, is passed along to the counselor immediately, because the schools have a protocol they have to go through, and then within the program that I work with, there is also, you can do bonus meetings with them as such, and work with them. And at those meetings, if you feel that, if I feel that there is a greater need or a more extensive need, then yes, I would reach out to Ms. Watson or Dr. Watson, and I would, get some guidance in that way. Who do, what program should we refer this, to this student to?
Awesome. Okay, so
Okay, perfect. Next question is, do you have programs available to nonprofits?
We are nonprofit, aren't we?
Yes, we are a nonprofit, and if we do work with community partners, so if there's a community partner that's willing to allow us to come in, definitely we can provide the services.
And then this is, how is your work funded? Grants, donations?
Grants.
Yeah.
Fully covered by grants.
So you do a lot of grant writing.
Yeah, I do my part with the grant writing when it comes to the different programs, but we do have a grant writer.
Oh, good. Otherwise, you just be doing that all day long, Yeah.
Next one is, do you implement ACEs screenings, or is that pretty much what the PCPs do?
So we don't technically have to include the ACEs. However, if you feel it's going to give you a broader range and picture of what the young person has experienced, you can definitely implement it, but it's not recommended.
Yeah.
Thank you.
And then, do any of you work with social workers and the county?
Yeah, we're contracted through the county. So the only time we'll work with social workers is if they're at the school sites, but directly working with like foster care agencies or DPSS, no. But if they're open to it, if there's a social worker who's like, I'm aware of your programs, can I refer students or, make the connection? Again, we are very non-traditional. So as long as we have a safe place that's confidential, we definitely can meet with those referrals.
Very good. Well,
Dr. Hougen, I think Dr. Hougen had a response on that too.
Yeah, I feel sort of obligated to just chime in on that. We have multiple programs that we've created to work closely with the county social workers. And oftentimes the nature of the program is to get them being the youth, to a program like Dr. Watson's, right? Where we have someone who navigates that for the family and navigates that for the kids, because that's critical. So that does happen all the time.
Oh, okay. Interesting. Thank you.
And this is a comment from Dr. Case. It says, among problems is the video gaming content and a general breakdown in communication between parents and children. And many parents are trying to figure themselves out. Very true. And this is another question. Is there a way to have direct relationships between primary physicians and the resource?
I'm
sorry, right here. I'm sorry, it cut off. And the resource or referral centers. This would ensure continuity of better results.
So it sounds like you're saying, are we able to have like primary care physicians make referrals if they feel they have a youth in need to our services? Yes. However, that's not a territory that we've ever embarked on. So that would be something that we could probably start researching, is gaining relationships with the doctors in the areas that we service, so they're aware of these things as well.
Huh.
One of the
That's
One of the
interesting.
difficulties with it is that the rules, the legal rules regarding sharing information are very different for a PCP and a mental health provider. And so best intentions can bump up against legality pretty quickly and make that difficult. And so we do try to promote that and make that happen, but it's a real struggle, and only really one of our programs has been successful at it, because they're dealing with the 0 to 5 population, and so the pediatricians are much more responsive to what that need is. But even there, I would say it could be greatly improved. The other ones, it's very difficult to make that connection. Again, very hopeful about SB HIP, because the whole goal is to facilitate connections, and it's being done by our managed care plans, which have very easy access to the primary care physician. So hopefully that'll, culminate in something that includes that better communication.
Right.
Hmm.
Okay. Thank you.
And next one is, do you work with faith organizations?
Yeah, again, we can work faith-based, like I said, community partners. So whoever's open to receive our services, we definitely can make that connection.
Next one is, schools are the obvious door for behavioral health services for youth, and there's an associated payer system. Are there any solutions outside of schools, especially for teens no longer in school?
Yeah, that's where like the TAY drop-in centers will come into place. So if these, if they're not in school, they can go to these different places. Now, I don't know about all of them, the 3 that I mentioned, one's in Riverside, one's in, I believe, Thousand Palms, and the other one is in Paris. But those are safe places where they can go if they need to get services. And any kind of like
Foster
youth
care
centers.
agencies,
Mhm,
maybe? Foster
mhm.
care, contacting, offering our services to them and have us go in. Although most foster care agencies have their own, or they have to in order to.
Oh,
But
Mhm.
sometimes, they don't. Like, I worked through an agency, but it wasn't foster care. It was for the kids that come in through the border illegally. And so they had all legal services, and they hired a lot of people, myself included, to handle these situations.
wow.
Yeah, and they problems. They have a lot of problems.
Yeah, I bet. Go ahead, Dr. Hougen.
Just want to make sure Gary gets an additional answer, which is really there's no program we have that requires the school referral. So if there was a teen that didn't want to go to a drop-in center but was in a high state of need, absolutely we could facilitate them being seen. We could do the assessment at home. We could do, there's a variety of things. It's just really reaching out and us knowing about the kid. And making that referral to the provider. Could be a community-based organization that does it through one of our full-service partnerships. Could be one of our TAY centers without making the kid come in, right? Could be one of even our school-age treatment services program serves youth that aren't in school, right? Because they've dropped out or something like that. So there's a lot of options there.
So if like Gary, that was a great question, Gary. Thanks. So if Gary had somebody through one of their programs at United Way, he became aware of, he could reach out to you about this, right?
Well, yeah, absolutely, Gary. Please email me, send me a question. But you were asking sort of how a referral would be made. The easiest, everyone wants one point of contact, right? Regardless of how big your program is, you want one point of contact.
Yeah.
211 would be a really good reference for you, Gary. I recommend that strongly. It seems, I know. Really
I guess Gary's familiar with 211, right?
I think you may be. I'm not sure. The easiest thing, if you need one point of contact, is our 800 number, our 888 number, right? Because that's the DBH access point for mental health services. And I can put that in the chat so everyone can have it.
That'd be great.
But yeah, that's again, just for San Bernardino County, but they would be able to, if a family called and had a teenager who was not in school, they would be able to direct them to a program.
Okay. Very, very good.
And the next question is, how would the referral be done?
Oh, I guess you just kind of addressed that.
Basically, right.
Calling that number, basically, yeah.
Yeah.
Okay. And then Sandra Mendez put in a comment. She's a youth partner for Olive Crest in the residential department.
She would be a point of contact.
Mm-hmm.
I see. Yeah, Olive Crest, that's another wonderful organization. They're pretty well known over here. I'm in Palm Springs, and so there's a lot of people over here that are involved in that. That's good. That's great. Well, I don't see any other questions in the chat. Does anyone have any other comment or question you'd like to ask? Well, we have the experts here with us. You're certainly welcome to raise your hand, or I don't, since everyone's not clamoring all at the same time, do someone just speak up if you have a question? No more questions? Well, all right. Well, any of our panelists, is there anything else you'd like to mention that you didn't get to mention in the discussion?
Yeah, I just wanted to give reference and, say kudos to those that did share in the chat some of the things that were said against them. It's very unfortunate. And what I would just say is be mindful of your words when you're speaking to a seed that is still being cultivated, because you can speak life into that seed or you can damage it for life. So use your words kindly.
Wow. That's good. That's really good. And Denise Green has a comment. Your son has panic attacks when he has to attend school. Denise, so sorry about that. It must be very stressful for the entire family. Does he have, or is it an unpleasant experience for him when he gets to the school setting? Is that what's going on? Okay. Victoria, yeah.
I just said, piggybacking on Dr. Hougen's referral to Wildhood, which I'm definitely going to read. I discovered a book I found extremely helpful. I have a granddaughter who's a teenager now. And since I didn't raise girls, I wasn't sure about teenage girls. So I went looking for some resources, and I found a book called Untangled. And so I don't know if anyone else is familiar with this. It was written by a psychologist who works with teenage girls. And I found it very helpful. She outlines 7 developmental stages for teenage girls from the age of 13 to 19. And I found the information really helpful. So I don't know if anyone else is familiar with that. It's called Untangled. I think the first name of the author is Lisa, but I can't remember her last name at the moment. And you can get it on Amazon.
Thank you.
It's a lovely way of conceptualizing that transition, right? Because it's that same thing of going from childhood to adulthood, but with way more specific wickets that need to be successfully hit, right, for that development, right?
Right.
I mean, one of my favorite ones is one of the stages is called joining a new tribe.
Yes, the first stage.
Right.
Yeah.
And so it's that sense of, okay, really that is the sense of connection that young women are creating, is that level of intensity. Yeah. Right. And just recognizing that. Yeah. It's a great
and what
book.
I like,
nice recommendation.
The two things I liked about it was that it gives parents or whoever's working with teenagers that it normalizes that process of transition. And I thought, because sometimes we wait till kids get to an extreme point just because they haven't had anyone understand that a lot of what they're doing and what they're feeling is normal. And so they don't get that conversation, that support, that interaction, those coping skills that we've talked about today. And then it gets worse because then they don't get all those at the beginning. And it's not, so I like the fact that she normalizes these stages of development. And then the other thing I liked is that every chapter then talks about the warning signs. So this is normal for tribal relationships and pulling away from the family. But if you see this, then you should be concerned or you should take additional steps. So I, as a grandparent, as well as a professional, I found it extremely helpful. I bought a copy for my son and daughter-in-law. I don't know whether they read it or not, but I thought, I think that's oftentimes we just, we don't understand what's normal.
Mm-mm.
And so
Thank
either we
you
overreact or we wait too long.
Thanks for mentioning that, Victoria, and then Dr. Right when you wrote that, Dr. Hougen wrote it too. So you guys were on the same wavelength on that, and that's a great resource for all of us. So, well, we have come to that magical time when y'all need to go back to your real lives now. And that was a really fascinating just discussion and exploration into this teen mental health issue. And we just want to thank our experts so much. We want to thank you, Dr. Nicole Watson. We want to thank you, Jessie Huerta. And we want to thank you, Dr. Timothy Hougen. You guys, we are all so fortunate to have you working in this field and providing the guidance and not just the professional, but the personal commitment you all do. Because if you didn't care and didn't have the passion about this that you do, there'd be no progress made in this field. So thank you all so much. We do want to remind you really quickly today at 2:00, so in half an hour, there is a Rural Health Task Force meeting through the IECHI, and most you should have received an invitation on that. It's a hybrid meeting in person and via Zoom. It's taking place physically in Big Bear Lake, but if you want to register on Zoom, there's still time, and it's on the IECHI website as well as the sbcms.com/events website. And that's talking about mountain resident health and emceed by Nicole McGivney with the Mom and Dad Project with Bear Valley. Okay. So any of you are certainly invited to that. We also want to remind you our next health education forum will be September 13th, and we will be announcing our topic and our speakers on that in the coming weeks as we get a little bit closer. So again, thanks everyone thanks presenters, and thank you all for joining us today. We really appreciate you all supporting these events and being engaged in them. So have a great rest of your week, everyone, and we'll send out a copy of the recording. And if Dr. Nicole's okay with it, we'll send out the slides. We'll check with her on that. Is that good? Okay.
Thank you
All
so
right.
much.
Thanks, you
Fabulous.
guys. We'll look forward to seeing you again.
Bye. And next